रुकिए ना सर।
हेलो।
अभी तक नहीं करना है रिकॉर्डिंग में, बोल रहा हूँ रुकिए थोड़ा दूर प्लीज।
हाँ।
और स्टॉप करेंगे, वापस आते हैं हम। Hello everyone, welcome to this webinar by Symbiosis Center for Emotional Wellbeing and Symbiosis Institute of Health Sciences from Symbiosis International University in Pune. And I'm Dr. Rahul Bagale. I'm the psychiatrist and deputy head for Symbiosis Center for Emotional Wellbeing. And as you are aware, we are here today to discuss about an important topic related to careers of students in the 12th grade. And as you could see on my screen, we are going to discuss today on career prospects in allied and healthcare profession. So this is something very interesting topic, and if you can relate to the current times when the students are probably just getting free from their exams of 12th board, and the parents are exploring various options that what can my ward or my child, my son, daughter can do in further career. And this is the right time, right place for you to get some understanding about career prospects in allied and healthcare profession. So allied and healthcare is something, a new term for you that we can understand. And that's why we thought it is important to explain you through a webinar what does it mean and what are the all professions included in this allied and healthcare profession. Okay, so let's begin with our webinar. And before we go to allied and healthcare profession, I just want to tell you from experiences of the parents we reached to. Like there was an era where students used to think about medical and engineering as the only two options, particularly after the 10th grade, whether they are going to choose something on a science stream and then they are going to choose something on biology or perhaps something on engineering or electronic telecommunication. So these were the two clearly defined things, and these were the professions known to people. And then suddenly we realized that there are, yeah, so we have the uh, joinings here. So welcome Bhavna for joining this webinar. And we have just started it, and we're just discussing that what are the career options beyond medical and engineering, because parents many a times see there are two options which are only lucrative or which are only going to get the safety in the career what usually people expect for, or some kind of a assurance that there will be jobs or opportunities to pursue that profession and gain some kind of a value or gain some kind of a recognition in the community or society. So as medical profession, we know that it brings a certain kind of a appreciation from the society that okay, it's something a noble profession. And the engineering also, like constructing something or creating something, makes the person's experience this value in the community. But beyond that, there are many unexplored professions, and for this reason, we have arranged this webinar. And we are going to start with the national education policy, which came into action in 2020, which was drafted that time, and thereafter it came into action with some kind of a new set of values, a new set of principles which are guiding the further generation for education. Like this demarcation between humanities, science, or commerce is not been considered by national education policy, and the policy is very holistic, very inclusive, and integrates all different streams into together, and it avoids totally this demarcation between the commerce, science, or the humanities and arts stream. So this is a wonderful step for next generation, that they don't have to just think from one perspective, because once they start doing some kind of a profession, they need to know certain technologies, they need to know certain commercial aspects related to it, they need to know the scientific approach and the evidence based practices into that profession. And there cannot be such demarcation between any profession. That is what been put forth by this national education policy. And now I'm going to give you a scenario like when I went through some data, like how many seats for medical are there in all over India. So I came across a number which is around 76,000 seats of medical MBBS seats in the all states of India. They are inclusive of all government, private, and deemed university seats. And when I came to know that this is the number of seats, I was just curious that how many students will be appearing from all over India for this 76,000 perhaps seats. And then I came across the number is about something 24 lakhs plus. So if you see that almost 1 in 30 student is going to get selected for medical course, MBBS course. And this is how tough the medical competition has been. And there are some other factors also, like probably the number of medical seats will increase and the need is equally demanding. But mind you, as I am a medical doctor and I know what are the World Health Organization rules for a doctor to patient, doctor to population ratio. And India has reached that ratio. Like India has reached 1:1,000 ratio for a doctor to population. And that is how something we need to be very uh, clear that further adding doctors into the community is only going to make something difficult for this ecosystem, because there are available doctors, but if they are not employable or if they are not able to run their practices, then in next 5, 10, 15 years the situations are going to be tough. And that's why I want to emphasize the parents that medical is a prestigious program, MBBS, BMS, or any other path you are choosing for your child. But there are other professions which are equally required. They are equally acclaimed by society. They are having much more wider chances of employability, and they can be suiting to your child, perhaps based on the discussions we are going to have in next part of this webinar. So there is no need to fear if your child doesn't get a medical. Let them try for it. It is a good thing that they try for NEET UG, they prepare for it, they learn through it, they become aware about some science, science, then physics and chemistry, because that is going to help them do anything they do in the next part of their profession. So let them opt for it. I am optimistic that they should do it. But if they don't do and if they're not able to make it, then there is nothing to be really worried that okay, what next, because we devoted all our 1 year 2 year repeat years, like people are there who are repeating for 3 4 years to crack the medical entrance. And that is something we are worried about, like putting all these things into one profession and then feeling burdened, pressured, or sometimes feeling helpless that, oh, I put all these years into this profession to just get entry into. And thereafter, the journey of MBBS, it may be 5.5 years, then again the post graduation and all. So it is a long journey for medical. So if your child gets a good score in NEET UG and they get some medical admission, please go ahead. If they just miss it for some marks and they feel they want to do only medical and they want to repeat, fine, maybe one attempt they can consider to get into the medical stream if they were just falling short of some scores. But if your ward is not, or your child is not something able to reach to the necessary percentile for this NEET UG, and there is a high kind of a need, or there is a high kind of a wish that I want to do it, but there are certain skill sets which may be really required, like some kind of intelligence into physics or biology, inclination into those subjects, some kind of ability to solve multiple choice questions, analytical thinking, sometimes putting very hard work, like sometimes they have to study for number of hours and prepare for this exam. So if any of these skills your child is not able to do, let's not force them to do NEET UG with repeated attempts. There are other professions which are included in allied and healthcare, and where they can start working into the health sector. I am making you aware again that there is no need to be only doctor to work with patients or to help patients or to help to bring some change in the community. Doctors are essential and there are many doctors available, What is needed is currently allied and healthcare professions. You see, there are many hospitals running. You see, there are many other professions which are required, and there is no number of professionals adequate available. And that is how this National Commission for Allied and Healthcare Practitioners Professions, National Commission, has been came into existence in 2021. And this is something interesting to know, that it came into action in 2021, and it has clearly mentioned what are the professions which can be included in National Commission for Allied Health Professions. So the reason this act was enforced, because see, medical doctors have some registry, like their medical council the registry there, where they are registered and they follow certain standard of practices and they are part of this profession. For engineers, there may be something a different kind of a set, like their degrees have been registered and they have certain experiences with that. For other practitioners in healthcare, like particularly in healthcare, we see there are many counselors who have no registering body. We see that there are many technologists in the healthcare who have no registrations, and their degrees are valid but they are not registered under any body. So this NCHP, National Commission for Allied Health Professions, brings a broad ambit under which all the professionals can get registered. And this is how it brings regularization to the universities and the various health related programs, that how these programs can be run, how there can be the syllabus or the courses decided in this program. And also we see sometimes people do a very short course somewhere here and there, just for the sake of getting called, say, a counselor or something, but they are not up to skill with that essential needs of that profession. There are many certificate courses, but they are not something they will be entitled to get registered under NCHP, and they may not be called as counselors or psychologists thereafter. So mind you, if you are choosing something a very shortcut which is not registered, not something approved by NCHP as an organization or university, then probably it is not going to be a long journey or fruitful journey, and you may land up in some trouble. So make sure that you are getting your admission in allied healthcare through proper universities and the programs, so that you go smoothly in your journey. So what NCHP provides is the registration. It has just recently started 2021. And NCHP has a central council, the National Commission, and the state council. So it is in the process of state councils getting formed, and accordingly the organizations can get enrolled and the degree programs will be registered. The students passing will also get registered. So it is just the start of the process now, but it will set a standard of care and practices in this profession. So there was nobody to look after like what kind of a care should be provided by these professionals, and they were just doing based on their own experience or their own education. And now with NCHP they will have a kind of a organization which will do proactive steps in advancements and latest scientific advancements, and making research also part integral part of their bodies or their professions. So this is how NCHP is required. And we have one more guest, Dhanaji, joining. So welcome, Dhanaji. And we just discussed few things about careers prospects in allied and healthcare profession. We moved from medical to engineering to national education policy. Then we discuss about how much proportion of students actually get admission in NEET UG as compared to the number of applicants, and unfortunately it is 1 is to 30 or something less than that. And other professions we have started discussing now. So why National Commission for Allied and Healthcare Profession is important: to bring regularization to the universities and the health programs, provide registration to the graduates, and setting a standard of practice for that profession. And it also provides ample scope for research and latest scientific advancements. So let's see one by one some of the major professions which are included in National Commission for Allied and Healthcare. So biotechnologies, it is something which you already must be aware. There are various BSc, BTech programs in biotechnology available. So these professionals can get registered under NCHP once they complete their graduate degree program, and they deal with various things like how the changes in the chemical or the biological aspects of any kind of industry, say farming industry or human sciences or genetic kind of sciences. So there, what this biotechnology can make a change. Microbiology is something very small particles. It may be the fungi or the yeast or some kind of infective pathogens. So how to study them? They are done by microbiologists. And as you see, microbiology, biotechnology, they are morely into the chemical and the biological aspects. So suppose your ward or student is more keen into the microorganisms and the various biotechnological kind of technologies or various advances. They're fascinated with that and they want to explore it further. And these are the wonderful profession. Like they can find out various programs at various universities which will provide microbiology into BSc into microbiology or biotechnology, and that is how they can choose their career based on their innate tendencies or their innate potential, and also other kind of professions. So physiotherapy is one more. So physiotherapy is something you already know. Many professions are there, but there hadn't been any kind of registering body, unfortunately. Also for occupational therapies. So this is something which, suppose the medical is not available, but your student or your child is getting admission into physiotherapy or occupational therapy. So maybe you can choose that physiotherapy and occupational therapy, and there will be professional registration for this ward once they pass these exams in the graduate. So physiotherapy is something related to the physical form of therapies, particularly if you are aware about some orthopedic doctors, like the doctors who work on bones and joints. So after the surgeries are done or the recovery of joint muscles is happening, sometimes even after the cardiac kind of illnesses or the lung infections, there is a need to do some kind of procedures or the maneuvers so that there is a regain of the control or the ability or the potential of that muscle groups, and that is how the physiotherapists are involved into it. So this is a wonderful profession. Like if you are feeling I want to work with patients, I like to be with patients, I like to help them gain back their physical health, and that is how brings a smile on their face, then physiotherapy is a good profession. You can think about it and you can opt for those entrances also. Occupational therapy, on the other hand, is something related to how the person is going to get engaged or get ready for what are their innate abilities. The occupational therapies are in wide demand. I want to tell you, there are very, very few occupational therapies. There was an era till 1980s, 90s when there were occupational therapies and colleges available. But now there are very less colleges what we see in occupational therapy, but with various issues like intelligence quotient assessment, the IQ assessment, then sometimes with the neurodiverse child like ADHD or autism spectrum conditions, there is a high need of occupational therapists so that they can work along this child, they can provide the right support, they can provide the therapy in the form of various games and various kind of thoughtfully invented kind of acts which help them to recognize what are they are able to do, and keeping them engaged and help them regain their intelligence quotient to the optimal level. So this is what occupational therapists do. As we know, we can't totally change these conditions. Like if you see the new autism spectrum condition or intelligence quotient, like suppose there is an intelligence uh, disability due to lower intelligence levels, so we can't totally recover it, but we can help to bring some changes in that person's life so that they become occupationally functional. So these are the changes which occupational therapists can do, and they can provide them certain trainings through which they can learn those procedures and they can implement it, and they can gain a sense of control on their muscle groups, on their intelligence, or their motor activities. This is how occupational therapists do. And also we see in medical colleges, many times there is a need for persons who had been on leave, say suppose for few months due to major health conditions. So they want to rejoin the colleges, and if they want to rejoin colleges, they need to get assessed by occupational therapists that to what level they will be able to work and function in their jobs or their employability. So there also the role of occupational therapists play into role, because they can mention about how fit the person is to get back into the job what they were doing before. So this is also something you can work with a diverse range of populations, starting from children, adolescent to middle-aged populations. Occupational therapist is in high demand. Then there is a medical lab technologies. So there are many medical labs you might be seeing on every square of every city, town, and place. And there is a high need of technologies being available there. So the pathologists, which are the doctors, they can just provide their opinion based on what kind of a report is generated or what kind of a film is generated from the pathology. But the medical lab technologies are managing all these labs, and I want to tell you they are equally important as pathologists. And that is how a lab runs in a teamwork where there is a pathologist also and medical lab technologists also. And the technologies help the pathologists to get into any kind of a procedure. Like suppose there is a procedure need to be done where a section of organ is being trying to be mounted on some films. So medical lab technologies can arrange for the equipments, and the procedure may be conducted by the trained professionals, say pathologists, and that is how it is been done. So technologies are really important because many machines are there in medical labs, if you are aware. So many lab machines, they can be only aware to medical lab technologies. Even sometimes the pathologists may not be aware about the technical part of these machines, and there they have to rely on medical lab technologists who know about how to calibrate, how to start with the machine, and how to get the right kind of a result which is expected from that test. So this is how medical lab technologies professions are also widely in demand. And then we have anesthesia assistant. So anesthesia is basically giving some kind of a medicine or the drug through which there is a kind of a loss of consciousness, and which is essential in certain surgeries. Like suppose there is a surgery need to be done, say a cardiac surgery. So there will be some anesthesia, general anesthesia, which will be required so that the surgery can be done very well, and there will not be any disturbance or any pain to the patient. So this is what the anesthesia means, and anesthetists are something which are doctors after MBBS who do their post graduation in anesthesia, whereas anesthesia assistants, they are the professionals who help in the operation theater for anesthetists, medical doctors, like how they can be the part of the team in the anesthesia, monitor the vitals, provide the right kind of drugs, or making sure that the procedure is being conducted well. Whatever assistance is needed, that can be provided by anesthesia assistants. Although currently there may not be so much professional degrees available. And we have one more guest, and welcome for this webinar. We already begun, and maybe we will send you the recording of the previous part, and you can start listening from here that what all professions are there beyond medical profession or beyond engineering profession, because we want to see a kind of a hybrid thing where medical and engineering comes together for the benefit of patients, hospital, and community care. This is what we are trying to give you a vision about what all professions we can have. So operation theater technology. So operation theater has various machines, various equipments, starting from the boils apparatus to disinfect the things, and other all the operating kind of like there are like orthoscopy and other surgeries there. So we need a team of professionals who are expert in this technology, which can help to run the machines well, which can help to troubleshoot if there are any challenges in the machines and the technology, so that the procedures are conducted uneventfully. So this is something what is needed in current era of advancements in the medicine. And so allied health professionals are what they are required, because a doctor cannot perform without the help of technologies, without the help of assistants. And that is how there is a need of these technologies required in all the hospitals. Dietitian, as you are aware that people have certain issues with the diet, and that is contributing to the metabolic diseases like diabetes, hypertension. And many times the physicians may have very less time, like they will check the report, they will examine the patient, they will get the parameters, and they will choose the right form of medicine for that patient, but they will not have time to tell what to eat, what not to eat, and how to manage their nutrition. And that is how the role of dietitian and nutritionist comes into play. Like they can be practicing independently or in the hospitals, they can get accommodated, or they can work in alignment with physicians. So the physician will, or the medical doctor will do, or the MD medicine doctor, DNP medicine doctor will do the medical part of the treatment, whereas they can refer to the dietitian and nutritionist so that they can help to gain a right kind of a nutrition and follow the diet which is necessary for that person's condition, whether diabetes. As we know, India is already on the verge of getting a diabetic kind of a capital, and there is a high need of dietitian nutritions, particularly in the metro kind of cities and also the middle town cities, because the number of population facing these conditions is high. Hypertension also, and various thyroid related condition, metabolic conditions. So there is a dietitian and nutritionist, and I want to tell you that Symbiosis has a course under culinary arts and nutrition for dietitian and nutritionists. So that is something we can add upon. Then optometrist is something, you know, that there are various shops of spectacles now, various chains of various brands of opticians are there available now, and that is how optometrists help in providing the services, providing various kind of changes, because it is also advancing. Like the specs are advancing, there are various options of specs, there are goggles, and also there the optometrist can sit their independent thing, or along with ophthalmologist, the medical doctor of eyes, they can set their own kind of a setup over there. Let's see some more professions now. So occupational health and safety officer, this is a new profession, and it is, mind you, it is also equally demanding, because there are many industries, and if you see, there are industrial kind of a clusters have been started by governments, and there are, say, thousands of employees or laborers working into that kind of a setting, and managing their occupational health and ensuring their safety standards is important, and that is how occupational health and safety officers can get registered under NCHP. But they need to be medical graduates. What I have been aware, that this is requires a medical graduation, and thereafter they can do certain programs under occupational health and safety, and they get registered under National Commission for Allied Health Professions. Now coming to something which is very interesting. So we discussed about machines, we discussed about hospitals, we discussed about patient care, but there is something very fascinating in person's life, which is what we see, how the person thinks, how the person make certain choices, and how the person starts having certain kind of a behaviors as integral part of their character. So there is a field called behavioral health sciences, which is a special domain under this National Commission for Allied Health Professions, and which includes psychologists, behavioral analysts, and health educator counselors, along with social workers, which may be medical or psychiatric social workers. So for this purpose, we are starting to add something very crucial, that psychologists, we know that the RCR registered psychologists, like MPhil psychologists, they have a different body, like RCI, registering council for them. So they get registered under it, so they don't need to get registered under NCHP. But there are thousands of counselors who have done masters in counseling, they have done MA or MSc into counseling, maybe clinical or other applied psychology. So after pursuing that graduation and masters in psychology, they are not able to get registered under any kind of a board, and this is going to be get solved through NCHP. So psychologists and the counselors are going to get registers under NCHP soon, because there is already a registry started, and we know we have a team of 25 counselors in our Symbiosis Center for Emotional Wellbeing, and they have been notified that they can get themselves, or they should get themselves registered under NCHP, because the announcement is there official, and people have sent their registration. Many people have got their registration number also. So this is the advancement in the NCHP, that people can get a license number for their counselor or psychologist profession. And there are behavioral analysts also required, like how the behavior of certain people or the community or the organization works into any kind of analysis and of their goals, and so This may be required in various community and corporate settings also. So this is what we want to emphasize, that psychologists and behavioral analysts are a rising profession because there are many mental health conditions. If you see the ratio of psychiatrists to population, it's still not adequate. There are still more number of psychiatrists required, and many times we see. Yeah, so we have one more guest now. So welcome to this webinar, ma'am. And we are ahead of some discussions, but you can get the link of this webinar after it is completing, where we are just discussing about psychology and behavioral analyst as the profession, which can be pursued after BSc into psychology or behavioral health sciences particularly. There can be health educators, like those individuals who want to work in the hospital setting. They want to deal with patients. They need to know about what all things that can be done to improve healthcare outcome of an individual. Or they, if they want to work only on mental health aspect, like say anxiety or depression, how to help people along with the psychiatrists and the team and the social workers to deal with various kind of situations through some therapies like CBT, REBT, which are some therapies which can be learned after this program. So this is what the ultimate goal of person who can pursue psychology or behavioral health sciences. And health educators and counselors are also integral part of NCHP, and they can help people understand what is health. Like people don't know any details about health. There are many misconceptions, myth around health, and people need to be educated. And there is a high need that the huge population which is not aware learns about health through various mechanisms. Say there may be some kind of a setting where they announce it, where they maybe do it through offline or online mode. And the counselors are required along with various settings, including psychiatric hospitals, psychiatric clinics. They can have their independent counseling space. They can work along with organization, universities as a teaching faculty or staff after qualifying certain educational requirement and research. So this is what health educator and counselors can do. Then the medical or psychiatric social worker. So these are the specialization, medical and psychiatric. There is a bachelor in social work, and thereafter they can do masters in either medical or psychiatric social work. And this is something very important, that field, that how to make an individual integral part of the society. That is what the noble work is done by social workers. Like there are many NGOs working in the social work domain, like Tata Institute related. Some NGOs are there. Many corporates, many entrepreneurs are forming their NGOs so as to just facilitate the corporate's social responsibility, the CSR responsibility. And there is a wide scope for social workers also to do the work into the community where they feel like appreciated. They feel a sense of fulfillment that I made an impact into someone's family. Because we know someone like Dr. Bharat Watwani. So he started a rehabilitation center in Karzat. He's a psychiatrist, and he's a Magsaysay awardee psychiatrist, I want to tell you. So he started a rehabilitation center, and he used to get the roadside beggars and other destitute people who were not having any shelter, any home, any food facilities, and they were diagnosed by him after evaluation to be having some kind of mental health conditions. And then when he provided the right medical care, they looked into the rehabilitation of these individuals, the persons with these conditions. The social workers help Dr. Bharat Watwani to get the persons into their own towns and villages. So they reunited their family with the persons, and that's a noble work that social workers do. So this is based on each person choice, and we just want to explore what all facilities and what are inner kind of tendencies or inner core principles which should govern you or your child. So these are some things, like if a person is very empathic, they want to understand, and they are a good listener, they can be good counselors. So these are the skills required. If they have inclination to psychology as subject, even during graduation or before 11th 12th, so they can think about psychology or behavioral health sciences for this purpose. And there are some other professions, we'll just mention them, which are the newly emerging engineering related. So they are mostly related to machines. Like someone wants to deal with machines, like they want to help the medical and health facilities, but they don't want to see the patients, or they don't want to do through any kind of a patient connect, because they are more into machinery work. So they can choose engineering, but if engineering is not feasible or they find something more fascinating, there are nuclear medicine technologists, radiotherapy technologists, medical physicists, biomedical engineer, and ECG technologists. So these are all professions which are available. So before we conclude this webinar, I just want to emphasize that Symbiosis International University has a program on BSc Behavioral Health Sciences. So previously it was called BSc in Mental Health or BSc Mental Health Honors, and it had two options: just the plain honors 4 degree program and honors with research. So these two options were there. And now, as per NCHP guidelines, we have just renamed this program and modified it so that the students appearing for this exam or coming for graduation, they get the right registration under NCHP. The program is headed by Dr. Girija Mahale, who is the psychiatrist and around 15 years of experience, including her experience in Australia. She has the qualification for Royal Australia New Zealand physicians also. And she's been heading this program under Faculty of Medical Health and Sciences, which is the faculty under Symbiosis International University. And the provost sir, we have Dr. Rajiv Yerbadekar sir. So under this legacy, we are running this program in BSc Behavioral Health Sciences, honors and honors with research. There are ample opportunities. So we have not demarketed it like humanities. Like people who do psychology, they may be just doing humanities as major core subject or some languages, but they will not get exposure to actually see the patients. What is the benefit of working or registering for BSc Behavioral Health Sciences? That you are going to be at the campus where there is a hospital and a psychiatric unit. There are patients with psychiatric conditions who can be seen by you under your guidance, and you can see the patients and see the hospital also. There are various visits at hospital which are being arranged by our professor's guidance, and students are reaching to surgical wards, they are reaching to medical wards and see actually how the patients are experiencing some conditions, and how behavioral sciences principle which they are learning into their graduation can be implemented into the well-being or improving the health of the patients in other departments also. So this is how we are trying to create an ecosystem where students have access to the counseling work, where they are getting trained into counseling, where various behavioral health sciences principles they are learning into the teaching classes, the hospital ward visits and the visits at the community centers and the private rehabilitation centers, psychiatric particularly, where they see the patients and how they can learn some techniques, maybe in their masters about the rehabilitation and other aspects. So this is all the prospectus of students who are registering for behavioral and sciences BSc, and we encourage you to log in on to www.sihs.edu.in, and there you will get the BSc Behavioral Health Sciences tab under programs, and you can registrations are open. That is wonderful announcement for you that we have started enrolling students and on board after the right procedure. The procedure is including some kind of a statement of purpose, like how and what purpose they have for getting registered for this program. There will be an interview and the 12th grade exams. We are going to count their scores. Based on that, there will be merit list, and you can secure your admissions. Although your results are waiting, it will be a provisional admission, and after results, we will confirm this admission. And the eligibility is you need to have 50% marks in 12th board exam, and you need to complete this procedure of statement of purpose and the interview. So these are the some prerequisites for admission into BSc Behavioral Health Sciences, and it is a 4 year degree program. So we want to make you clear that you need to complete this 4 years to graduate as per NCHP to get the license also. So this 4 years we have some basic courses initially, like biological determinants, psychological and social determinants of mental health. which help you to gain an insight about what happens in the behavioral health sciences and mental health aspect. Then we also teach psychopathology, which is nowhere you are going to get learn. Psychopathology and managing the psychiatric, helping to manage the psychiatric emergencies along with the hospital setting. These are the courses which have been run in this program. So you are going to get exposure at the graduate level, which will be much more than any masters in psychology, because you are going to learn actual practical clinical skills that we are going to demonstrate. We are going to have some kind of a certain hours of internship where you can expose yourself and get learn submerge yourself to learn something which is a practical training in that profession. So we want to make the graduates only employable. That is the principle of this program that what we are working on. And you can also pursue masters. So from 2025, there is going to be masters in the behavioral health sciences also from our institute itself, the Symbiosis Institute of Health Sciences and the Symbiosis University. So you can pursue masters into behavioral sciences, or you can do masters in other streams like counseling or clinical psychology, even applied psychology based on the university's requirement for that eligibility. So you are going to be having ample opportunities there after you complete this graduation. So this is about the program BSc in Behavioral Health Sciences. And any doubts you have, any concerns you have about BSc Behavioral Health Sciences or allied and healthcare professions, you may please feel free to ask. And that is how I wanted to inform you that there is something more than medical, which is more equally important and valued and respected. And there are some good employing opportunities and good salaries also if you are looking for salary perspective. And there are some technological related advances which are required in various hospital setting. Suppose people are more inclined with machines or engineering, they can choose those professions. Whereas people who are empathic, they want to help people think, work on their thoughts, beliefs, and actions, and their emotional experiences. Then they can choose BSc in behavioral health sciences. Yeah. Thank you for attending this webinar, and the house is open for your questions. Please share. Yeah. Are there any questions? Please feel free to ask. We are open for us getting your questions. Okay, so thanks for joining. And those who miss this webinar, they will get the link for this webinar on YouTube. So stay tuned and make sure that you think informed choice when you're choosing for your student, ward, or friends, like how their profession can be something which will be helpful for hospitals and the communities, and they invest their time in the right way rather than chasing something which seems difficult at times, like repeating for medical for multiple years should not be the option. There are valuable years of your life, and choose something which suits you, your requirement, and your abilities. There is no harm in choosing something which suits yourself. So trust yourself and trust your intuition. Identify what are your core skills. If you need any help, you can get help from career counselors also. So they can guide you if there are any conflicts, like I want to do this, but I am better in these things. What are the thoughts and conflicts which are not helping you to choose the right form of education degree? And wish you all the best for the further entrance and the admissions. Looking forward to see you for the next webinars. And I also want to announce that the next webinar is going to be exclusively on BSc Behavioral Health Sciences, which will be done by our program head, Dr. Girija Mahale, ma'am. So it will be hopefully on 8th of March. So you will get all the things on email and registration. So stay tuned for 8th of March. And you can follow on Instagram symbiosis underscore emotional well-being, or on LinkedIn you can follow us on Symbiosis Center for Emotional Well-being. We are present on Facebook also with the name Symbiosis Center for Emotional Well-being. So there you can get updates about the next webinar, and wish you all the best for your further journey. Take the right decision and go ahead with your own clear observation and intentions. Okay, take care. Bye. Most welcome. Yeah. Bye.